हाय फ्रेंड्स, आई एम डॉक्टर आशुतोष गुप्ता। आई एम ए कंसल्टेंट फीटल मेडिसिन। सो आज हम बात कर रहे हैं टेट्रोलॉजी ऑफ फेले के बारे में। सो दिस इज़ मोस्ट कॉमन, वन ऑफ द कॉमनेस्ट साइनोटिक कंजेनाइटल हार्ट डिजीज़। और हम ऐसा समझते हैं कि जो 4 चेम्बर व्यू हार्ट का जो होता है, विच इज़ अ वेरी इंपॉर्टेंट एसेंशियल टूल फॉर स्क्रीनिंग ऑफ कॉमनेस्ट congenital abnormalities of the heart. But until unless we try to look around for the outflow tracts from the great arteries, ये जो टेट्रोलॉजी ऑफ फेले है इसका डायग्नोसिस मिस हो जाता है. So 4 chamber view can be essentially normal in a tetralogy of Fallot, right? So अगर LVOT और RVOT जो आउटफ्लो ट्रैक्स है ग्रेट आर्टरीज को, अगर उसको भी हम कंसिडरेशन में लेते हैं फॉर द स्क्रीनिंग ऑफ द कंजेनिटल हार्ट डिजीजेस, तब हम इसको पकड़ सकते हैं. So we have a perimembranous VSD, you have an overriding aorta, and depending upon the pulmonary arterial stenosis, you can have a right ventricular hypertrophy. So इन सब चीज़ों को मिला के टेट्रोलॉजी ऑफ फेले बोलते हैं. So I am going to show you one case. तो मैं ये केस दिखा देता हूँ, तो इसको आप अगर ध्यान से देखिए तो वी कैन आइडेंटिफाई कि ओवरराइडिंग आउटा है ओवर द IVS. So if you look around, the interventricular septum has got an override aorta and it is opening in both right as well as in the left ventricle, right? And depending upon the flow that is coming from the left ventricle and the right ventricle, we can even appreciate the movement of the interventricular septum like a clock moving, like a clock movement, okay, between the outflow tracts of the LVOT and the RVOT. Okay, so this is an override and a perimembranous VSD, and then the override of the aorta over the interventricular septum. And then we try to look around for the 3 vessel view. We try to look around for the trachea. इसमें right aortic arch के association trough के साथ में काफ़ी common है. So we try to rule out the right aortic arch, and then the whole idea is to identify the pulmonary arterial sort of an stenosis and vis-a-vis the right ventricular hypertrophy proportionate to the pulmonary arterial stenosis, right? So इस case में at the moment what we are identifying is this is the TR of the heart. Tetralogy is one of the commonest cyanotic heart disease. 4 chamber view heart can miss this diagnosis, and this is a cyanotic heart disease. And the postnatal outcome is directly proportional to the antenatal diagnosis that we make. So increment in the diameter of the ascending arch of aorta, and deceleration in the growth of the pulmonary artery, duct dependence, reversal of flow in the ductus. So what we can identify is this, that we can prognosticate antenatally what is the severity of this tetralogy of Fallot. And pulmonary arterial stenosis can also be looked around for this thing. So what we've identified is this: the postnatal management can be tailored, can be done according to the severity of the antenatal severity of the case of the TOF, so that we can plan the delivery in pediatric cardiac centers, and we can rope in the pediatric cardiologists so that they know the case beforehand, and they can take care of the baby after the baby is born. So the postnatal prognosis definitely improves whenever we've identified the antenatal diagnosis of TOF, and we have looked around for the severity, and then we have put a word about the severity of the TOF, right? Thank you very much for your patient listening.